Thanks, Winnipeg. And Minister Miller, welcome to our APTN News.
Well, thanks for having me, Todd.
First off, I'm going to ask you, Indigenous leadership has largely been praised for its COVID response. Infection and death rates are much lower than Canadian averages. So is this proof that they're more than capable now to control their own health care in the future? And should that mean an overhaul of the First Nations and Inuit health branch?
Well, it's an excellent question, Todd, and it plays into how self-determination is really operationalized when it comes to some of the basic things in life, which is the health and well-being of the peoples. And you know, one of the specific items in my mandate letter is working towards distinctions-based health legislation, which, as you can appreciate, will vary from community to community, and that will require, and particularly a sobering discussion, and I would say a more accelerated discussion coming out of at least the first wave of COVID, knowing that we have to stay vigilant. And while I do appreciate the numbers and the work that's been done, it's something we keep an eye on, knowing how imperfect that data is, particularly when you try to parse out the off, quote unquote, the off reserve rates, which is harder to discern. You know, leadership, health leadership has played an exceptional role in ensuring their people stay safe. But to your greater point, which is self-determination over health, it is I believe a basic right. And science proves that the medical outcomes are more positive when people control their own healthcare systems. So this is an engagement that is going to take some time to elaborate over the coming months, but it is something our government, and indeed my mandate letter, reflects a dedication to.
You mentioned you don't have a good picture of what the data is. You admitted that a couple of months ago, back in May. What has been done to improve that, and maybe possibly will it be ready for a second wave?
Well, Indigenous Services Canada, recognizing that data was imperfect, and brought home to most through the exceptionally alarming rate of infection that we saw hit La Loche and the corresponding incredible response to it that is essentially stamped out COVID in that area. Those numbers would not necessarily be reflected in what we tally, but yet they are Indigenous. They are subject to the same vulnerabilities that Indigenous peoples on reserve would experience. And this is also compounded in urban areas where you have an overlap of jurisdictions, provincial providers or territorial providers, and getting simply the raw data and piecing it together. We've funded at Indigenous Services Canada various initiatives through experts. Ms. Smiley was one of the more noted ones, but who will be yielding results, I believe, preliminarily shortly, that will try to paint a better picture, specifically as to what's happening in a more off-reserve or urban setting. But that is something we recognize as a government to force a better look at disaggregated data for two things: to respond to the current wave, the next wave, and also ultimately to respond better to public health policy. And this phenomenon exists equally for racialized communities across Canada, and it's something our government recognizes the challenge, but also is willing to assume it and work towards getting that disaggregated data.
Okay, I want to switch topics here. And remind you that back in June, after the police shooting of Chantal Moore, you said you were pissed off at how this could happen during a wellness check. Now, the Public Safety Committee has been studying systemic racism in the RCMP, and some of that study may end up being amendments to Bill C-3, the Act to reform the RCMP. But is that enough?
Well, I think what you'll see over the next short, medium, and long term, Todd, and part of what it goes on at committee has to be reproduced in other settings of engagement with community leadership. This has been, leadership will tell you that this has been studied time and time again, and the recommendations are clear. One of the paths forward, which has been stated by the Prime Minister and Minister Blair, is treating policing in First Nations as an essential service. In tandem with the reform of the RCMP, we've had a lot of discussions about defunding, but the real discussion is ensuring that that people are treated with respect, that they are that institutions in government that are subject to systemic racism, and the RCMP is not the only one. There are others, but they do have exceptional powers, and they must be exercised with extreme caution. So reviewing the spectrum of the use of force, having more respectful engagement with communities. These are all things that have been recommended in the past, and we have to ensure that they are reproduced on the ground.
Finally, Minister Miller, there haven't been any updates lately on the lifting of boiled water advisories. March 2021, which is the deadline, is not that far away. Are you still on target to meet the Prime Minister's promise to have them all removed by then?
Todd, we are moving aggressively to lift those boiled water advisories. These are, they've taken on a political dimension, but they hold a very human dimension, ensuring that communities have safe access to water. This is something our government and our department in particular is moving on. I've asked my department, despite COVID, despite communities shutting down, to continue to move aggressively. Obviously, that is done in tandem and in partnership with local leadership that is as we are working at breakneck speed to ensure people stay safe. Any infrastructure build, as critical in nature as water and getting new infrastructure builds in, takes time, takes deliberation. There are wide variances that cause delays, and sometimes actually we are surprised by how we can accelerate things. So we're moving. I will have a better sense of things once we are able to get a sense of how much we were able to do during the summer. Things are moving positively. In the next month or so, we'll probably have a number of lifts, which is encouraging. But this is something, and regardless of any deadline, this is something that will need a long-term solution going forward. March, or at least the spring of 2021, is a very important political deadline. It holds immense value for this government, but it is something that we will have to be dedicated towards the long term. And we not only recognize that, but we hear that from leadership. And it is something we will continue to do in partnership with Indigenous peoples.
Just finally, again, what I'm hearing is that maybe in a month or two, you may definitely know whether you can meet that deadline or not.
Well, like I said, I've asked my team to continue to assess every single project by project, engage with community leadership like they've never done before, knowing that the challenges of COVID and communities that have literally shut down access to and sometimes departure from community, except for absolutely essential services. These are factors that we are not blind to, but it is something that we consider water essential. Indeed, the communities do as well, and we'll continue to move aggressively. And if we need to deploy more resources to ensure that we meet our goal, that is something we are prepared to do as well. But again, it is very much a long-term engagement of this government. It should not be a partisan thing. It should be a long-term engagement of every government. And that is sort of the legacy we want to leave, to ensure that no community is left without safe and clean water.
Okay, Minister Miller, I want to thank you for spending some time to speak to us.
Thank you, Todd.
Now back to the studio.